All right, welcome back. You're watching KTN Prime. Now get this, Kenya is currently on the brink of a health catastrophe as medics and public health facilities have downed their tools, demanding better working conditions, implementation of the CBA, posting of medical interns, medical cover, amongst other issues. One of the unions currently on industrial action is the Kenya Union of Clinical Officers, whose members were on the streets today agitating for PNP, that's permanent and pensionable for UHC staff. Now, for more updates on their grievances and the status update on the negotiations so far, I'm joined by George Gibore, who's the Secretary General of the Kenya Union of Clinical Officers. George, thank you so much for your time. Karibu sana.
Asante sana.
I know you've had a long day. We saw you on the streets.
Very. It was part of our work, and we appreciate that you have given us a very good coverage.
Definitely. And I mean, it's protected under the law in terms of peaceful protests. So let's start on that particular note, because you're on the streets today agitating for your cause. And this is coming just a day after President William Ruto said that the wage bill is already bloated. Today, he said we must live within our means. This could be a subliminal message to the striking doctors and clinical officers and the laboratory operators. What does this message resonate to you, bearing in mind the tight fiscal space we find ourselves as a country?
I think when we talk about that, we need to actually break down the numbers so that we get to know where does this wage bill lie. Is it in the health sector or where is it? And we want to tell Kenyans that spending and paying healthcare workers is not actually more of expenditure. It is more of investment, because you invest in people's life. So it cannot be called expenditure and then you dismiss workers. Remember, we do not have enough staff. So we believe that the advisors of the president need actually to take him to update and inform him that we are below. Like today, if we had to go by our own policy, the staff establishment, we are supposed to have close to, in 2018, we were supposed to have close to 30,000 clinical officers in the country.
Okay.
We are now projecting close to 58,000. The government has only 6,948, those who are employed on permanent and pensionable, and the others 800 who are on contract. So, and that is why we are saying this is not for healthcare workers, it is for the poor Kenyan who take more than 24 hours to 2 days waiting to be seen in a public health office, public health facilities.
Okay.
We are only asking that the president promised Kenyans that he will indeed change the approach in the health sector, and he went ahead, put it in his manifesto. And one of the promises he gave Kenyans is to employ more staff so that we can actually expand our coverage. Because coverage means that I get services when I need it and the way I need it.
Okay.
And it should not be delayed, and the cost actually will go down, because if you have a patient who needs to see a specialist and must come from Migori to Nairobi, that cost has been transferred to that patient. And those are some of the unnecessary expenditure that we normally see patient actually suffering. And we are saying that in a well-projected, well-thought-of a healthcare system that is fully functioning, then we must be able to see a deliberate approach from the president and the leadership who are action-oriented to focus to ensure that one of the key pillars in the health sector, the human resource component, is well addressed.
Okay. So let's talk about deliberate action so far, because ever since you went for industrial action roughly over a week ago, we've seen some effort by the government, at least publicly, in order to quell this situation.
Yes.
And in the earlier report, by a reporter, she detailed that the unions have been called for deliberations by the National Assembly Departmental Committee on Health. That's on Wednesday this week. So let's get the current status of negotiations with the national and county governments.
Very well. I'll start from where I left,
Yes.
so that I tell Kenyan, because I've seen what the president did was addressing Kenyan, and he knows that he has a privilege of having crowd. And the Kenyan listened to him, but he need to tell Kenyan really that no clinical officer is asking for any increment. We are only asking for implementation of what is agreeable. Yani tunauliza deni.
So
we are only
hakuna
asking,
pesa
hakuna pesa
mnaoitisha
tunaitisha
kuongeza.
kuongeza. We are only asking in 2021, we agreed in terms of what you ought to pay the clinical officer as per the risk allowance only. And I must put figures into it. Like the Minister of Health require only 10 million for 1 year, a full year. All the other county, the most of county that spend higher is around 20 million to 23 million whole year to implement what we are talking about. Tell me, this is just a one tender that we normally see these people running and doing every day. The money that the short business that is happening in the county. So we are only saying that we are asking you to invest in Kenyan, because if you invest in clinical officers, you are investing in 54 million Kenyans who depend in the public facility, who do not have any other option, who's today they are visiting facility when they go sit on the bench and walk back home because they have no alternative.
All right.
So, and because of that then, I must say that we have had some discussion,
okay.
And more specifically the Minister of Health, and I must be categorical that the PS, Mary Modone, has been very responsible. We have had several meetings.
Okay.
We have discussed on the 10 point that we raised on our strict notice.
Right.
We have tried to see which one involved, like the Public Service Commission, which one involved the LSRC, and she has asked me to consult so that she sees how to especially unlock the deadlock, the stalemate.
So have you agreed on any of those 10-point issues?
No, I must be very specific that we have not agreed on any, as much as we have had several discussions. And of course, she has said that she must be able to actually negotiate. I think then, when you look at how she has approached the issue, it can only signal that this is more of a momentum, a time that we'll have seen the whole country approach to address the issues of the health. Since we went to devolution, we have had more than 100 strikes, which affect the health sector, specifically the public sector, and the people lose life because of the same. Okay. So far, nothing has happened. We were actually invited for conciliation under the Ministry of Labor last week, and again, the Council of Governors was a no-show. And I must also make it very clear that we have a court order since last year, November 8th, ordering parties to go back on the table to finalize on the CBA and ensure that we have a signed CBA with the court. The Council of Governors has never obeyed this court order as much as the ministry has been. We feel that they are the biggest letdown, okay, and actually the problem why we are in this crisis.
Well, we definitely hope the counties come to the negotiating table so
yes,
we can find an end to this impasse. So when you go to the negotiating table,
yes,
there are things you can, say, we can leave this, but these are the irreducible minimums. This is what we want implemented short-term, immediately, or long-term. So let's talk about the irreducible minimums. For clinical officers to go back to public health facilities, what box should be ticked, bearing in mind the fiscal space we're in?
Rogers, if you are the government, then that will have been a very good question. But now, unfortunately, you're asking me to negotiate with myself. We want the government to come on the table, say you had 10 agenda.
Yes.
We are willing to address 1, 2, 3. As to now, are you willing? Because the negotiation is a give and take. True. Nothing has been offered as to now.
But what's of priority to clinical officers?
The priority to clinical officers, and you'll see, and all issues are relative. I can put some maybe context into some of them.
Briefly,
one,
yeah,
we are looking at the government to approve our career progression, which normally give us a pathway in terms of how we need to grow. All these clinical officers were employed either as a diploma, but if today you go to do some audit, like here in Nairobi, probably a majority have even master's qualification, but they have not been redesignated. A majority have not been promoted,
okay,
because of failure to have a career progression.
What
Two,
is
that we need our CBA be finalized and be deposited with the court. 3 is we need our interns to be paid as per the approved job establishment by the Public Service Commission. 4 is implement the agreement with the ministry on payment of the risk allowance. The last one is that the UHC who actually served us during the COVID and we lost a number of them. We need them to be actually respected and be put on permanent and pensionable because they are paid punitively, and they're the one who bailed us during the COVID time. So we wanted the government to give it a consideration and put them on PNP.
And in just a minute or so, because there's been a public debate on the role of interns,
yes,
medical doctor interns and clinical officer interns as well. Let's highlight your view, because we heard from the CES mentioning that they deserve just a stipend, because these are interns. But we've equally heard from the doctors saying that these interns play such a crucial role in the healthcare system, especially in public health facilities. From the clinical officer's point of view, briefly, how important is applied to the interns?
Let me say, one, if I can break it, one is that do we have any role in terms of, can we stop either giving them internship or taking them for internship? I think we are training for the globe, and we have to benchmark with the best practice. These are key people who make a decision in terms of what intervention can be taken to you when you come to the hospital. So they must be trained, and after they have done with their theory, then they can come and incorporate the same with the practical part of it. And this is the whole year that we normally now put them, so that you release them to go and independently do the work. Then the next thing is, when they are in our public facility, actually they contribute to 27% of our workforce. And it's not that they are just there, and they work day and night, mark you. And that is why the government has been for more than 7 years paying them as they have been paying. So I cannot say that now maybe the life is on them. That's why the government has chosen now to take away or to reduce their payment. The government has not justified what they are doing, and we must call it as such, and we must say that this is an act of destabilizing the sector, and specifically the public sector. Whoever is doing this, either they have their own private facility that they want actually to gain through this, or even pushing it down so that we can have cheap labor in our market.
Okay. We definitely hope for a quick resolution to the issues. You'll be meeting the Departmental Committee on Health on Wednesday.
Yes, that is a good one, and we want to say that this is the first one that we are seeing as a joint committee looking into the issue, because they represent Kenyans who are suffering today, and we want Kenya not to be lied that healthcare workers are looking for any increment in terms of pay. We are only saying employ more staff so that those Kenyans do not suffer. They can get someone in their facility. In Nairobi, we have close to 22 facilities which are not working today. We want them to be fully functioning. So we believe that the deliberation with the committee can be able to have a headway in terms of resolving the impasse.
Well, all the best, Bwana George. It definitely is a trying time, not just for patients in public health facilities, but the union members as well, who have to down their tools. Remember, industrial action is a last resort.
Yes.
So it seems you've been pushed to the wall, and there was no other alternative.
Very true, very true.
Well, we definitely hope for a resolution. Asante sana for your time. He's the Secretary General of the Kenya Union of Clinical Officers. As we've highlighted, there's a pending meeting at the Joint Health Committee of the National Assembly with the unions this Wednesday. And trust us as KTN News to bring you up to speed with the latest. We take a short break, but coming up,